for nearly 50 years. Joining us now, Republican Congressman Joe Wilson from South Carolina. Congressman, are we going to see bipartisanship on Thursday?
I hope so, and Dylan, it's an honor to be with you. And what I'm hoping on Thursday, and I need to point out something. You indicate that the Republicans had been involved. We were not involved. The bill that was presented to us on July the 14th was not one that came through committee. Republicans were not at all at the table in developing the bill. When it was considered before the Education and Labor Committee 2 days later, again, we had not been involved. When we offered amendments, and we offered, I thought, very constructive amendments, they were voted down largely by party line votes. Fortunately, one came through that I introduced that provided that if there was a government option that members of Congress must take it if it's so good. But we need to have, beginning Thursday, hopefully, you would take the Republican proposals, the President's proposal, and do a side-by-side. I've been on conference committees in the past. That's how you look and see where you have points of agreement. You pointed them out. You have about pre-existing conditions, portability, wellness programs. We all agree on those. And then you debate the issues you don't agree, and then you, in a conference committee, you take a vote, and then you have a final bill. That's the way it should work.
What are your thoughts on somebody like Paul Ryan's roadmap for health care reform, another member of the Republican Party, vouchers for one of the big things that strikes me about the employer-based health care system is that the tax subsidy is given to employers so that they can forego giving somebody like me or anybody else more compensation because they get a tax subsidy for health care, so they say we'll give you health care instead of a raise because the health care costs the corporation less because they're getting the tax break, and in the process the employees are denied any real opportunity to have portability in their own lives, not to mention real compensation. Paul Ryan, I think, has a brilliant idea, which is to take that tax subsidy away from corporations who use it basically to forego having to pay and to subordinate their employees, and to liberate people by giving individuals the tax break for their health care. This is also something that has been a feature piece of the Wyden-Bennett proposal, which is a long-standing bipartisan piece of legislation. Do you get the sense that the types of real change, structural change that would liberate people, reduce cost, increase quality, and add universal care, but would disrupt the special interests that are the insurance monopolies, drug companies, and employer-based health care system are possible with this Congress?
Well, actually, you and I agree on something, and that is that Paul Ryan is brilliant, and I hope you have him on more often because he really understands the issues. It really is substantive change. It provides for accessibility.
With him?
Yes, I do. In fact, and I spoke with him this morning. I said, hey, Paul, I'm really looking forward to you traveling the country and explaining your issues because he's addressing real issues. Last week, as I was working on promoting jobs in South Carolina, everywhere I went, people would ask about this issue, and I mentioned to them how fortunate we were to have good leaders like Paul Ryan, Mike Pence, and Eric Cantor.
What confuses me is that whether I talk to somebody like yourself, I've talked to Representative Ryan in the past, and I suspect I'll talk to him again soon. I'll talk to Ron Wyden. I'll talk to Maria Cantwell. I'll talk to Democrats. I'll talk to Anthony Weiner from the House. Yes. And all of you will make very good sense in the conversation on the television. And you're very rational, and I can say, well, this is a problem. You say, yes, Dylan, that's right. You've observed the problem. For instance, look how big of a percentage of our budget health care is. Each piece of paper in these stacks, and this is the budget from the president, is worth $400 million. Each piece of paper is $400 million. The Republican plan cuts $68 billion. That's 17 pieces of paper, right? The one that was on the website. By the way, the Senate plan passed by the Democrats is not much better. And no one is dealing with the structural problem, which is the empowerment of special interests who profit by virtue of the fact that they have favorable treatment in the tax code, in the bidding process, and in the disconnectedness of the relationship between patients and the cost of their health care. And neither the Republican plan or the Democratic plan has addressed any of those things, even though you or Paul Ryan or Ron Wyden or anybody else that I could talk will give me solutions. It never seems to be in any of the political proposals.
Well, actually it is, and I